Hi families, hola familias, it's Miss Molly, soy Miss Molly, and today I'm going to be reading Why Did the Whole World Stop? Talking with Kids About COVID-19. Why Did the Whole World Stop? Talking with Kids About COVID-19. Written by Heather Black. It's amazing how fast the world changed in response to COVID-19. You might be wondering, why is this such a big deal? What happened? When will things get back to normal? Should I be scared? When can I see my friends? What can I do to help? You might not even be sure what everyone's talking about. Learning more about COVID-19 can be useful. Coronavirus protection. This book can help you understand more about COVID-19 and even give you some ideas on how to use this unusual time for good things. What does the novel coronavirus, COVID-19, get its name? Novel means new. Coronavirus, a specific group of virus germs. Corona, which means crown, because the virus is like a little crown under a microscope. Virus, a tiny particle that only multiplies inside a live host, like a person, animal, or plant. Disease, something that makes people or animals sick. And 19, named for the year 19, the strain of coronavirus in people was first reported in the World Health Organization, December 31st, 2019. Who decided we should stay home? When something major happened in the world, like a new disease that is contagious, leaders of countries and scientists worked together to figure out the best way to protect people. Many things changed quickly in response to the outbreak of COVID-19. Schools closed. Teachers and students had to find new ways to keep learning, like online classes and homework assignments. The playgrounds closed. Germs can stay alive for a while on surfaces, like a ladder or swing. Later, they might pass to a new person who touches that object. So many public areas were off limits. Events were canceled. Any activity that requires people to get together had to be delayed or canceled. Restaurants delivered food at the door or to homes. Some businesses had to close temporarily. Some people worked from home. Their jobs might be done on a computer or phone. Some people were out of work. Their jobs could only be done in contact with other people. Some people had to go to work more than usual, especially those who worked in healthcare, like doctors and nurses, might be busier than normal. So many things changed at once. It was a little bit confusing. People wore face masks and gloves, when going out, to be extra careful about the germs. Some people worried they might run out of things they need, so they bought extra. Shops ran out of things like toilet paper, hand sanitizer, bread, milk, and rice. People ordered things online they might usually get from the local store. This let them get things they needed without going out. In some places, the government leaders told people they must be home by a certain time of night. That is called a curfew. Part of a police officer's job includes making sure people had an important reason to be out. Otherwise, they weren't supposed to leave their homes. Nearly everyone around the world tried to practice social distancing. That's staying out of large groups, keeping space between yourself and others, and simply staying home. How does social distancing help prevent the spread of COVID-19? Virus germs can't move by themselves, so with fewer people going out, there's less chance for germs to spread. If someone gets sick, it is easier to figure out where they might have caught the virus. It helps keep hospitals from having too many patients at once. That allows them to serve everyone better, including those who are sick, with other things hurt or having babies. How contagious is COVID-19? Just one sneeze can spread over 20,000 droplets containing virus particles. That's why it's important to cover your face when you sneeze or cough. What is a pandemic? Pan meaning all, demic meaning people. A pandemic is when many people in different parts of the world catch the same disease at the same time. The World Health Organization declares COVID-19 a pandemic on March 11th, 2020. COVID-19 was first discovered in the city of Wuhan, China in December 2019. That may be far away from where you live, but many people travel to different parts of the world every day. In just a few weeks, there were outbreaks of this disease in nearly every country worldwide. How is COVID-19 different from other diseases? Everyone gets sick sometimes, but our bodies have immune systems to help fight diseases. Think of your immune system as a guard, and the billions of viruses and bacteria particles around your body, us like tiny travelers who want to come in and out of our bodies every single day. Why is it spreading fast? Some bacteria and viruses are good for us, or at least not very harmful, and our immune system lets them in. It quickly attacks ones that it knows might make us sick. Because COVID-19 virus hasn't made people sick before now, our immune system doesn't know whether the virus is good or bad, so it doesn't fight right away. We have no immunity towards COVID-19. Is it possible to slow the spread? Yes. You have probably heard of people talking about flattening the curve. That means trying to reduce the number of people who get the disease at once. Is there treatment for COVID-19? A COVID-19 vaccine. Researchers are working hard to make specific treatments and vaccines to fight the disease. Vaccines would work by helping our immune system. Is there a treatment for COVID-19? Researchers are working hard to make specific treatments and vaccines to help the disease. Vaccines work by helping our immune systems identify disease so it knows to attack the germs. What happens if you get COVID-19? Most people who catch COVID-19 don't get very sick. They may feel bad with a fever and cough for a little while, but their immune system is able to fight against the disease and win. They get better. A few people can have COVID-19 but not feel sick at all, even though they are still contagious. For some, hospitals can help. For some people, the COVID-19 disease becomes more serious and they have a hard time breathing. These people may need help with a respirator in the hospital while their immune system fights the disease. Some pass away. Sadly, a few people are not able to recover from the disease and they die. This is true for many other diseases too, but since COVID-19 is new and widespread, it's getting lots of attention in the news around the world. You might be wondering if there's anything I can do to help. The answer is yes. Respect social distancing guidelines. This helps everyone. Wash your hands. Use water and soap. Focus on the palm to palm. between the fingers. Focus on the thumbs, back of the hands, and focus on the wrist. Clean hands can help keep you healthy. You can pray for those who are sick, ask that they will recover soon and that the virus spread will end. Call someone who might be lonely. It's great to let people know you care about them. Get some exercise. It's important to stay active. Use your creativity. Make something new with your talents. Keep on learning. It's always a great time to learn something new. Help out at home. Do your part to keep things pleasant around the house. Spend time with your family. Make some great memories. Look forward to the days when we can all get together again. Every day, things will feel exciting and new. The end.